when you hear the president say that the cases will probably peak soon, how do you read it? Does he have insights that we don't?
I think we have to be very skeptical about this claim. All the way through the pandemic thus far, at various points, the president has said it's about to peak. But we don't really know what data he's looking at. I think one of the big questions in Indonesia is the data. The testing capacity is just so limited right now that there's a very high positivity rate. So a large number of cases are being found every day relative to the number of tests, which suggests Indonesia, according to the WHO guidelines, doesn't have the virus under control right now. So I think it's hard to know what evidence he's going on. And while Indonesia already has the highest death toll in Southeast Asia, most epidemiologists believe the real spread of the disease is far, far wider, and it's simply not being captured in the data.
This is having a real toll on the economy, isn't it? Because millions have been unemployed. The poverty situation in the country is getting worse, not to mention a weak healthcare system. How big a setback is this pandemic to the Indonesian economy?
I think it's a big setback to the economy, and it's a big setback for President Jokowi, as he's known, because he is first and foremost an economy president. His legacy is going to all be about what he did on the economy, his move to increase infrastructure, to improve the health and education systems. And Indonesia is now facing its first recession since the Asian financial crisis in more than 20 years. Poverty has taken a big hit. Millions of Indonesians have lost their jobs. But more importantly than that, the many tens of millions of Indonesians who work in the informal sector are in a really difficult position because they really have to get on with their work. They can't work from home if you're working as a driver, a construction worker, a service worker in a mall. There is no work from home. There's no Zoom for you. You have to get on with it if you want to survive. So there's this really fragile balance between the health system and the health situation in the economy, but there's no easy answer. And it seems like the government is almost having a herd immunity strategy by default, letting the virus circulate because they're so worried about the impact on the economy. But I think so long as the virus is in free circulation, it's unlikely that you can get the economy going back to normal.
You know, it's interesting, Ben, because a lot of the challenges you just laid out there are those that are being faced by countries and leaders around the world. But given that you know Jokowi so well and I've spoken to him on so many occasions, I mean, what are his personal skills, his aptitudes, his inclinations that you think made his response perhaps different to COVID and will continue to do so?
Well, I think we have to give Jokowi and give Indonesia a bit of a break, a bit of understanding. We'll put some context here. Indonesia did have already an overstretched health system. It has limited financial capacity, so they can't bail out their economy in the way that Singapore has, that Australia has. It's really difficult, and Indonesia is not yet in as bad a situation as India, Brazil, or the US. But having said all that, I think for Jokowi himself, one of the challenges is he's a very practical guy. He was, first and foremost, he made his money as a furniture maker. And I think he sees the world in very nuts and bolts terms. And he goes on instinct, not really on information from experts. And that's been his political success. But when you're dealing with something as complex as a pandemic like this, I think you can't rely on your instincts. You need to listen to the experts. And that's, unfortunately, one of the characteristics we've seen him demonstrate, which has really hamstrung Indonesia's response.